Before the pandemic started, we were in the middle of looking at a 10-year plan on replacing some of our breathing machines, ventilators, and some of the other machines we use to help people with their breathing. Our fleet is aging, and we have a 10-year plan of turning things over to make sure we have the best, most up-to-date equipment. We are a small community hospital, but we do have a huge catchment area, and we pride ourselves in doing best practices, and having the equipment to support that is paramount. A lot of illnesses and procedures, people need ventilator support, help with their breathing. A ventilator can take over the entire work of breathing, so your entire job of breathing, and the patient can heal in other ways, expend their energy healing in other ways, or a ventilator can help with some of it as you recover. I liken it to a cast. You break your arm and you put a cast on it. That allows your body to heal that break and concentrate on that while supporting that arm. And that's what a ventilator does for your lungs. We assist with any type of breathing issues that you may have, right from treatments because of asthma to putting you on a ventilator because post-surgery, or putting you on a ventilator because you have a illness such as COVID or a disease such as COPD. We manage those ventilators, and we wean you off the ventilator. During the pandemic, we're involved in intubations, and during the pandemic that there was a little bit increased anxiety over that, because to protect ourselves and other patients, how do we do that safely? We are involved in taking the breathing tube out after your course of therapy. We are all on all code teams, so if there's a cardiac arrest somewhere, or you come in a trauma and you come in arresting because of an illness, we're involved in the resuscitation efforts, breathing for you, putting in that breathing tube. During COVID, we didn't know how this would affect, how it spreads, how quickly it spreads, and how much in danger we ourselves were in from catching this illness. So we were involved closely in the team approach of planning on how to protect ourselves, each other, and treat the patient for best outcomes.